Good afternoon. The National Cabinet met again this afternoon. We're going to continue to meet together on a weekly basis, as we have been now for the past few weeks, as we particularly deal with the issues that are arising from a very serious situation that is here in Sydney. I want to start particularly by extending my thoughts to all fellow Sydney-siders who go into even firmer restrictions as of this evening, and just simply say that we'll get through it together. This is a very necessary set of restrictions that have been put in place by the New South Wales Government. Strongly support them, and the Commonwealth Government will continue to provide the support necessary to give effect to those restrictions and to ensure that the New South Wales economy and the people of Sydney in particular are supported through what is this very difficult time. Many other cities, particularly down in Victoria and Melbourne, have gone through this before, and Sydney-siders, I have no doubt, will continue to push through. I know it's tiring, I know it's exasperating, I know it's frustrating, but we need to keep pushing through. And so my thoughts are with all of my fellow Sydney-siders today. The meeting of the National Cabinet today considered a wide range of issues, most of which was following through on decisions we'd taken previously and updating on those actions. In particular, in addition to getting updates from the New South Wales Premier on the situation here in New South Wales, and other premiers were very fulsome in extending their support to New South Wales, just as New South Wales has done in so many other cases when other states have found themselves in difficulty. One of the pleasing elements of the report we heard today was the flow on from the Tanami mine issue, where we had a worker who'd been through Queensland and into the mine. That outbreak has been able to be contained. That was one that was very seriously concerning us over the last couple of weeks, and so the practices put in place by the mine operators there proved to be very effective and very helpful, and we thank them for the way they did that. And it's a reminder that across so many workplaces in Australia over the course of the pandemic, very good COVID safe practices have been put in place, and that has enabled particularly our heavy industry to keep operating and keep operating safely. And on this occasion, where there had been a breach, still, because of the practices and processes they had in place, it meant that that could be tracked down very, very quickly. We're also noted today that in our own region, not only here in Australia and here in Sydney, but not far from Australia, particularly in Indonesia and of course in Fiji, they are facing even more serious circumstances. And in both cases, the Commonwealth Government, Australian Government, has been reaching out to provide that support to both Fiji and to Indonesia. And I was in contact only this week with the Indonesian President Widodo, only this week to that end. We noted that the Doherty Institute would be coming back to us over the course of this month. The First Secretaries Group, which is the heads of the Director Generals of the Premier's departments and my own Secretary of my own Department of Prime Minister and Cabinet, will be pulling that work together of the Doherty Institute. That will actually set out what the spectrum of risk is across various levels of vaccination in the population, and what the levels of vaccination in high-risk vulnerable groups are, and what the risk is then associated with COVID being in the community. That information will be combined together with the capacity of the health system and the advice of Treasury and Treasury secretaries around the country to ensure we get the best assessment of what the thresholds are to move from phase 1 to phase 2 to phase 3 and ultimately phase 4, which I outlined to you last Friday. So that work is in process. The Doherty Institute are continuing that work. On the vaccine rollout today, Lieutenant General Fruin was able to update the National Cabinet on the arrangements that have been put in place with Pfizer, which is bringing forward those vaccines out of our vaccine purchases, which were to be in place over the course of the year, and the new horizons, as they're defined by Lieutenant General Fruin, have been advised to the team leads in each of the states and territories on the projected distribution from those new brought forward supplies that will come available this month, that will see us rise to 1 million a week, that will see us move from 2.8 to over 4.5 million doses coming in from Pfizer in August. This is going to greatly assist the further rollout of the vaccine program, and today we have again seen very strong numbers when it comes to the vaccine program. The vaccine numbers that have been released today showed the second highest day yesterday that we have seen, some 164,773 doses administered. That gets us to 8.8 or rather 8.9 million doses as present. That would likely see us hit 9 million doses by the end of this week, most likely by the time we report again tomorrow. And so we will then be hitting that very important mark of 1 million doses every week. You hit your marks there, you hit your straps on those sort of a vaccination rollout as we are now achieving, and that puts us in a very strong place to be able to get this job done as we move towards the end of the year, and indeed perhaps sooner than that, to ensure that everyone who was seeking to have a vaccine would be able to have one. We also reported today, importantly, and did a stock take, and that will continue over the course of the next week in terms of our health system capacity. Now, what I'm referring to there is, you'll recall at the start of the pandemic that one of our key issues was ensuring that we had sufficient respirators and all of that equipment in place in the event of a very serious outbreak. Now, what I was able to report today is that the ICU capacity currently has Australia with 2,020 spare ventilators nationally, with an expansion capacity of some 7,500 ventilated ICU beds to treat hospitalised COVID-19 patients. Now, the states and territories, this will be a continued standing item on our national cabinet agenda to ensure that we have been able to maintain that health system capability to deal with any potential outbreaks. And there were no concerns expressed today by premiers or chief ministers in terms of their preparedness of their hospital networks to deal with any potential outbreaks. And the hospital capacity here in New South Wales, and in Sydney in particular, is proving to be more than up to the task of what is currently presenting. Also note, this Sunday, and Lieutenant General Philman will have more to say about that on Sunday, there will be a new campaign launched in relation to the vaccination program. This is the next phase of those communication campaigns. It coincides neatly with the additional supply that has been brought forward to support the vaccination program. On aged care, today we received the final presentations to Lieutenant General Fruin in terms of the InReach and Hub systems being put in place to support vaccination of aged care workers. We also discussed an incentive system today that was suggested by Premier McGowan, which I think is an excellent idea. We'll be engaging with the corporate sector as to how that can be put in place to incentivise aged care workers is another way of ensuring we lift those levels of vaccination amongst aged care workers. I had confirmation from all states and territories except Victoria today that they would be introducing public health orders to mandate the vaccine for aged care workers. I stress though that in Victoria that is not a decision of the Premier or the Minister. Under their legislation, that is an independent, a statutorily independent decision of the Chief Health Officer of Victoria. So that person is the only one who is authorised to decide whether to put in place a public health order, and so I would have to refer you to the Chief Health Officer in Victoria as to what his intentions are regarding the mandating of vaccines for aged care workers. There was also papers received from the medical expert panel that dealt with the vaccination of disability care workers, and while they're not at this point recommending mandating of the vaccinations for disability care workers, they are strongly recommending it, and so with that corporate program that can be used to incentivise vaccinations for aged care workers, we would look to extend that to disability care workers as well. We also considered for what I call mobility workers, those working in the air transport sector and other transport sectors, as to whether there was a requirement for mandatory vaccinations there. That is not being recommended at this stage, but of course across all the community where you're able to get those vaccinations, then of course we strongly encourage it, particularly when you're working in an area which would bring you into contact with more people. We also agreed today that a national cabinet pilot would be established for home quarantine. That would be done in a lead jurisdiction, and South Australia has indicated their intention to go forward as the host jurisdiction for that home quarantine trial, which would be a 2-week quarantine period based on the advice received from the medical expert panel, and we'll be working with South Australia to put that pilot in place as soon as possible. That will be a transparent project with all the other states and territories. It will be run, of course, by South Australia, but with the active engagement and visibility of all the other states and territories, so they are in a position to pick up that project on the completion of a successful pilot program. In relation to inbound and outbound travel, on inbound, since the announcement made last week, we have 29 now scheduled facilitated commercial flights that will be going into Darwin. That should see us taking in around 4,000 people a month into Howard Springs and fully utilising ultimately the quarantine capacity at the National Resilience Facility at Howard Springs. And I thank the Northern Territory Government for their close cooperation in getting those arrangements in place. We will also have the Australian Travel Declaration, which will be from the 16th of July. We'll be including information on inbound arrivals vaccination status. That will be done through what is called attestation. This is not linked up to other international databases at this stage. This would be requiring people to attest whether they have received a vaccination, the vaccination that they have received, the date of that vaccination, and the jurisdiction in which they received that vaccination. That will provide information, particularly to the states, who will be in a position then potentially to look at how they're managing quarantine operations in their state, as indeed the Commonwealth can with the Northern Territory Government at Howard Springs, to look at ways that vaccinated and non-vaccinated travellers can be treated in the quarantine program. Obviously those who are vaccinated have a much lower risk of infection than those who are non-vaccinated. And finally, on outbound, it will be our strong preference for those who are given an exemption, and there are very clear and limited reasons why people are able to travel outbound presently. That is our strong preference that people will be vaccinated if they're travelling overseas. That reduces the risk both to them personally, because as we know, COVID is riddled through many countries around the world and many of the places Australians will be travelling to. And that also, of course, reduces the risk of when they return to Australia. Now, for those who are unable for medical reasons to receive a vaccination, or at this point in the cycle they may not have access to that vaccination, well, there are obviously issues that will be taken into account by the Border Force Commissioner in considering those arrangements. Now, those last points that I make about outbound travel, the facilitated commercial flights, the Australian Travel Declaration, they are all decisions of the Commonwealth Government, and they were noted today by the National Cabinet. So, happy to take questions.
Prime Minister, now that the Pfizer supplies are being brought forward, will under 40s be able to be vaccinated in August?
I couldn't quite hear the last part of that question.
Will under 40s be able to be vaccinated in August?
Those decisions at present haven't changed in terms of the age eligibility, and they will be considered further based on this supply by Lieutenant General Fruin in concert with the medical advice that he receives. Remember, because right now our focus remains on getting people who are aged over 70 vaccinated. Now we are over that 70% mark, and 72% it was yesterday, of those over 70 who've received that first dose. Older Australians are still the most vulnerable, and that's why we would implore people who have eligibility for those vaccines now to go and get them, and particularly if you're waiting on your second dose and it's on AstraZeneca, well, as I said yesterday, the health advice I've received from Professor Kelly as well as Professor Murphy is that the balance of risk is that you should seek to have that at least at 8 weeks.
Prime Minister, Labor's tried very hard today to make out that this Pfizer news isn't really anything new or particularly noteworthy. What's your response to that?
Labor's always hoping for the worst. In the middle of a pandemic, this is very disappointing, and they're wrong. We've been able to bring forward these important doses out of our contracted program, which means they're available now in July. It's real. I don't understand why Labor always hopes for the worst. I mean, they hoped that 100,000, 150,000 people had lost their job at the end of JobKeeper. They were wrong. And they're wrong about this too. They should just get behind the program and stop trying to play politics.
But on the Pfizer changes, the delivery dates and the numbers that you're talking about today do appear pretty similar to what's been announced previously. Even Pfizer felt the need to issue a statement clarifying there were no additional doses coming this year.
I never said there are additional doses coming this year.
But
They're
Pfizer
bring
felt the
forward
need
doses.
to clarify that. And so, are we really talking about, changes here that are a game changer for our vaccination rollout? And if it is a game changer, what does that say about the situation so far?
What it says is that we will have more doses being distributed this month than we had planned to distribute it this month, and quite significantly more, and more next month as well.
So are these
we've
changes
been bringing forward the doses, which is what we've been seeking to do. And the reason we've had to bring forward those doses is because of the ATAGI advice on AstraZeneca, which has limited the use of that vaccine to be the workhorse of the vaccination program. And so since we've had that advice, and so that since that impact has been made on the vaccination program, it has been our priority to work with Pfizer to bring forward the doses that we've contracted, and we've been successful in doing that.
Prime Minister, did the government have to pay an extra price to bring forward these doses of Pfizer? And sorry if you press this, it's hard to hear back here.
Sure.
What is the difference, how long will it be when those vaccines actually land and then they end up in people's arms?
Well, on the first point, I mean, the commercial arrangements between us and Pfizer are not matters that we go into for commercial and confidence reasons, and so don't draw any conclusion from that. That's been our practice from the outset, and that will continue. In relation to the availability of those doses, well, we've gone from 300 to 350,000. That ramps up further to 1 million, and even more so or thereabouts when we get into August, because we'll have around about 4.5 million doses next month. It takes around about a week to 10 days or thereabouts from arrival up to, and it can be less than that for those distributions once they come in to go through the process, and for them to be making their way out to the GP surgeries or to the state-based vaccination clinics or whichever the point of presence is through which those vaccines are being distributed. I mean, we've got 1,300 extra GPs on the job this month to be supporting the rollout of these additional Pfizer vaccines. But the workhorse still remains. The job that needs to be done with the AstraZeneca vaccine as well, particularly for those who are aged over 70, but also for those who are aged over 60 and who are going through their second doses, encouraging them to do just that. It's incredibly important. But we're now, this time tomorrow, we'll be talking about 1 million doses a week. Now, that's what you need to hit in order to get this job done. And we've worked hard to get over the challenges that we've had in the vaccination program over the course of the last 4 months. It's been a tough job. We've got on top of that. We're now hitting those 1 million a week as of tomorrow. We believe that will see us really be able to get this job done in the months ahead.
I mean, is Sydney in the position that it's in because your vaccine rollout has been so slow?
No, absolutely not. There's not a country in the world other than Israel that has a vaccination rate of 2 doses more than 65%. Israel is the only country in the world that has that. Now, in Australia, the number of cases we have had in our community means that, say, compared to the United Kingdom, which had as many cases in 1 day this week as we've had in 18 months. So there's far more antibodies that exist, say, in the UK in the general population than in Australia, and that's thankfully so, because we've saved over 30,000 lives in this country by ensuring that we didn't lose that battle again in the first round against the coronavirus. And so it was always known at this time of the year, in July of this year, that we would still be in the suppression phase. And that means that in the suppression phase, you need to keep your systems as tight as possible. We've had breaches here, but there have been breaches in other places. And when there are breaches, it is about trying to contain it as quickly as possible and move as quickly as possible to get us in that situation, which is what the New South Wales government is doing.
Can you tell us the month when under 40s will now be eligible for the Pfizer Pfizer vaccine.
No, I'll leave that to Lieutenant General Fruin, and that'll be based on the medical advice and the supplies as he's rolling those out to meet the priorities of the vaccination program, which, as I said, is the most vulnerable of the population, which is those who are over 70.
Has there
Will
been
any of
plans
those-
to
will any
change
of
then
those-
for
will
that
any of those
eligibility?
Pfizer
One at a time, sorry, I can't hear you.
Will any of those Pfizer vaccines be diverted to Sydney to help curb the current outbreak?
Well, as I announced yesterday, we've provided an additional 150,000, brought forward 150,000 vaccines for New South Wales from the Pfizer distributions, and 150,000 of AstraZeneca. So New South Wales is receiving 300,000 additional vaccines next week. And that is not at the expense of what were the planned distributions of vaccines to other states prior to that announcement.
With the Pfizer vaccine, have we considered pushing out the interval between doses so that the supplies we do have can be used, say in Sydney during the current outbreak, to get more first doses in quicker?
Well, this is why we've just put an additional 300,000 doses into New South Wales next week.
Is there any possibility that you might extend JobKeeper? And do you agree with Philip Lowe, who said that migration has been suppressing wages?
Well, we're not bringing back JobKeeper. What we've put in place is the COVID disaster payment, which is set at the level that JobKeeper was at when JobKeeper ended at the end of March. We're in the position now where we have a very targeted need here in the Sydney metropolitan area. It's not a national, JobKeeper was a nationwide program. This enables us to directly make payments to people who need that help. And those payments, as we eased the restrictions on those payments yesterday by waiving liquid assets test yesterday, means that those payments will be available to more people in the Sydney metropolitan area that need that additional support. So we will keep working with the New South Wales government. I was talking to their Treasurer today. Again, obviously had the Premier on the National Cabinet call today also on what may be required pending what further decisions the New South Wales government may have to make to suppress this latest outbreak. So we'll work specifically in a partnered way on that. We'll do the design and the targeting in a way that's appropriate to that problem. In relation to the debate about migration and wages, I mean, we're in quite an extraordinary situation at the moment. It's not common to have net migration which is negative in this country, and for it certainly to be at zero. So that is an extraordinary set of circumstances. That's obviously put some constrictions on the labour market. But at the same time, we're seeing jobs picked up very, very quickly. I mean, particularly here in New South Wales, as I was discussing with the Treasury Secretary and the Treasurer today and yesterday, New South Wales comes into this most recent outbreak after some very strong performances. I mean, the significant levels that we're seeing on the savings ratios from the most recent national accounts, which is elevated still to the levels of the global financial crisis and higher. So a lot of Australians have been building up their balance sheets over the course of the last 12 months, which is giving them a bit of a buffer at the moment. Not big, not pretending it's big, but that means that they're in a position for short periods of time to be able to deal with this in a way that perhaps they weren't able to do before. And the labour market is incredibly strong. When we introduced JobKeeper, we were looking at 1 million people losing their jobs. Now the labour market nationally, and even still here in New South Wales, is strong. And so long as we can get on top of this in a reasonable period of time, then we anticipate that the economic impacts of this can be mitigated.
Prime Minister, what do you make of that pub in Melbourne?
Last
question, please.
Since it's become
What do you make
mandatory
of the
for
pub
age.
in Melbourne that's been asked by the TGA not to give free beers?
Well, the Health Minister and I noticed this yesterday evening, and the Health Minister, I asked to have a chat with the TGA. I mean, the rule is that, which they're just doing their job, the TGA, and the rule is that companies shouldn't be able to provide incentives of alcohol or cigarettes to get people to buy prescription medicines. Now that's a common sense regulation, but this is a national interest vaccine program, and we'll be making some changes to ensure that these good-hearted, good-natured sort of initiatives that people may take on of their own volition, which is the case of the PA in Victoria, or indeed of the type of thing that I've just indicated, where we're seeking to incentivise through the corporate sector vaccination of aged care workers or other important employment groups, then we just want to make sure that the rules are common sense. I think it was done in good faith and in a good spirit by the publican down at the PA in Melbourne, but I think also, to be fair to the TGA, they're just doing their job and they've got to follow the letter of the law there, so we'll tidy that up. Common sense will reign once again, and cheers to the PA.
Prime Minister, what's the earliest date that
Last
the
question, guys.
trial will begin in South Australia?
Well, they'll be working that through now. I mean,
Give us a
no,
month
I can't at this point. South Australia have only indicated sort of formally today at today's meeting that they intend to host that pilot, and so we will work with them now to set up the timeframes and how that will be put together and the transparency arrangements with the other states and territories. I think this is an important development. I think it's trialling out these new quarantine arrangements, which will take significant pressure off if it's successful. Of course, the formal quarantine system. If you're able to make this work, it means in phases, particularly phase 3, but even potentially in phase 2, you have a greater opportunity for Australians who are vaccinated to be able to leave Australia and come back and put no pressure on the hotel quarantine system, and that can see some of these restrictions ease with very low risk. The program will focus on countries, low-risk countries. That's the advice that's come through, and so South Australia will be very mindful of that as well. And the advice is also principally at first to focus on Australian vaccinations as well. So thank you.